Hi, my name is Kelly Cunahan, and today I will be talking to you about kidney transplants. This is for Dr. Reed's EXS 486 class. So first I'm going to talk about the role of the kidneys. So the kidneys are two very important organs for filtration of the blood. They regulate water fluid, filter waste from the blood, regulate blood pressure, initiate gluconeogenesis, which is the filtration and reabsorption of glucose in the blood, and regulate acid-base balance. So what is a kidney transplant? A kidney transplant is a surgical procedure that uses a donor kidney to replace a damaged one to treat kidney failure or disease. The first kidney transplant was performed in 1954. The kidney transplant is the most effective way to reduce high morbidity and mortality in patients with kidney diseases. But this does not reverse the damage done by years of decreased kidney function and dialysis. So some reasons for a kidney transplant include kidney failure, chronic kidney disease, end-stage renal disease, and also another option is dialysis, which removes the excess water, solutes, and toxins from blood in damaged kidneys. But this will only delay needing to get a transplant, and the average life expectancy on dialysis is about 10 to 15 years, but has been known to also go from about 20 to 30 years. Ultimately, the final decision with any of these diseases is a transplant, and some of the quote comorbidities leading to this transplant could include diabetes mellitus, hypertension, and obesity. So just to reiterate, the two top diseases for kidney transplant are chronic kidney disease, which is the presence of kidney damage, also the urinary albumin detected and low glomerular filtration rate for 3 months or more. And end-stage renal disease is stage 5 of chronic kidney disease, where the kidneys are only functioning at about 10 to 15% of normal capacity, and a very low filtration rate is also noted. So some symptoms and signs of kidney failure. There are 5 stages, going from about 90% of normal function to about negative 15%, which is kidney failure. And some symptoms and signs are reduced urine output, fatigue, nausea, swelling in the feet, tiredness, poor sleep, poor appetite, unexplained itchiness, swelling of feet, puffiness of face and eyes, and shortness of breath. So some kidney transplant stats are that about over 100,000 people are on the kidney transplant waiting list, and the wait time for a transplant is around 3.6 years, except for direct donations. And actually the reason I'm doing this topic is because my uncle received a kidney transplant and his wife was the donator of it. So I just wanted to learn more about that. So about 3,000 people are added to the list each month. Unfortunately, 13 people die each day waiting for a life-saving transplant. About 14 people are added to the list each day, and women are more predisposed to donate their organs compared to men. So since there is a very long waiting list, to narrow down this list, they came up with some exclusion criteria. Some of this criteria includes advanced age, severe heart disease, active or recently treated cancer, dementia or poorly controlled mental illness, alcohol or drug abuse, also patients' inadequate social support, limited understanding of the process due to inadequate education, and a patient's advanced age above 65. Also, any other factors that could possibly affect the ability to safely undergo the procedure and take the medications needed after a transplant to prevent rejection. So there are many risks after a transplant. The average life expectancy after a transplant is about 12 to 20 years. There is about a 30% of overall mortality in kidney transplant patients, and there is an incidence of myocardial infarction at 3 years from about 4.2% to 11.1%. There's also a high risk of atherosclerotic coronary artery disease, which is now 4 times higher after the transplant, with a risk of 37 to 58% of stenosis afterwards. About 50% of transplant recipients are also diagnosed with post-transplantation diabetes mellitus. This is treated through lifestyle changes, healthy weight maintenance, and pharmacological therapy. This number has been reduced to about 12% because of the use of corticosteroids, so there's less rejection. And another risk is also the immunosuppressant medication the patients take. This obviously affects the immune system, which then leads to a higher cancer risk and higher infection risk. So following a kidney transplant, there are obviously many complications, some of them being rejection, which can be acute or chronic. This is the elevation of creatine in the blood. Cardiovascular disease is also the most frequent cause of death after transplant, and immunosuppressant meds may exacerbate this rate. Infections are also a big complication because of the immunosuppression. Musculoskeletal disorders can also occur because of the glucocorticoid therapy, which reduces bone density and causes muscle protein breakdown. And obesity can also be a complication because most patients after a transplant don't want to overexert themselves, thinking less activity is better when the opposite is true. Some precautions to avoid after the transplant are to avoid strenuous lifting for 6 to 8 weeks and to stay hydrated to balance the new kidney transplant. After a transplant, a patient will recover in about 6 to 8 weeks. No exercise besides walking is mentioned until the incision is healed, but they do want to get the patients up in the first few days. Frequent checkups with physicians will occur because of the high risk of rejection. And speaking of rejection, some of the immunosuppressant medications taken could be azathioprine or cyclosporine, and also glucocorticoid steroids such as prednisone, which also is a rejection medication. After looking into kidney transplants, I found more research on the effects of exercise after a transplant. In this research, I found that greater physical activity is a statistically significant predictor of improved graft function over a 1-year period. This improves the perfusion and oxygen delivery to the kidney graft. Also, pre-transplant inactivity is a negative indicator of graft survival. And the physical activity also increases the glomerular filtration rate. Patients with advanced chronic kidney disease have lower cardiorespiratory fitness, which remains reduced by 30% after transplantation. But it was found that exercise improved this cardiorespiratory fitness and max capacity of aerobic activity after transplant. Also, an 8-week aerobic exercise program was introduced, which enhanced helper T cell count, natural killer cell activity, and IgG and IgM levels without causing graft dysfunction. So this improves the immune system, which has been damaged by the immunosuppressant drugs. Exercise was also shown to improve patients' mental status for those who suffered from depression or anxiety. Exercise also reduced the need for pharmacological therapy of hypertension in these patients. So for my case study, I based this off of my uncle. So John, a 65-year-old man, has had diabetes for 10 years and long-standing hypertension. He has just received a kidney transplant and is 10 weeks in recovery and comes to you for an exercise program to help aid his recovery. He takes public transportation and is used to walking to work. His goal is to regain muscle strength and bone density because of his long recovery period and muscle mass decrease. He is currently taking immunosuppressant drugs to fight rejection. He's still taking meds for diabetes and hypertension, such as glipizide and prednisone. After the transplant, his hypertension was controlled and lowered, alongside with lower cholesterol levels. His vitals, so his max heart rate is 155. His blood pressure was 140/88. He is 71 inches tall and weighs 160 pounds. So before my exercise prescription, I would do some maximal exercise testing after the client has been medically cleared by their physician and is in recovery after their transplant. I would test aerobic, resistance, flexibility, and balance. For aerobic testing, I would have him perform the 6-minute walk test. For resistance, a hand grip strength test would be administered. For flexibility, a sit and reach test. And for balance, the stork test, where the client will stand on one foot for as long as they can. For my exercise prescription for aerobic exercise, I would have him exercise 3 to 5 days a week with an intensity of 12 to 14 on the RPE scale. I would have him work up to 30 minutes of continuous exercise, starting with 3 10-minute bouts. And I would have him do some walking, light cycling, or light aquatic activity. For resistance training, I would have him perform 2 to 3 days a week at an intensity of 10 RM, low impact. I would have him perform 10 to 15 reps starting with one set with 8 to 10 exercises. I would have him use some machine weights, resistance bands, isometric exercises, light hand and ankle weights, and also some body weight resistance such as squats. For the flexibility prescription, I would have him perform this daily at an intensity when he stretches until mild discomfort. I would have him hold each stretch for about 10 to 30 seconds. The static stretching could include the pigeon stretch, butterfly stretch, calf stretch, or straddle stretch. For balance, I would have him perform this 5 days a week because of his age at an intensity until his stability wavers. So I would have him perform these holds for about 10 to 30 seconds until the balance wavers. I would have him perform static and dynamic holds, such as standing on one leg, adding eyes closed if it's too easy, walking on a straight line with one foot in front of the other, and balancing on their tiptoes. Some special considerations after the kidney transplant and exercise is that the patients are weak initially after transplant, so progression of the prescription is key. The clinical status of the patient is very important in case of a medical setback. Many transplant patients have a fear of overexertion, so again, progressing slowly is optimal. Infection, because of immunosuppressant meds, is still at a high risk, so making sure that all the equipment is clean and no threat of infection is there. Prednisone, which is an immunosuppressant med, may also cause slower adaptation to resistance training and muscle gains, so that should be relayed to the patient as to why some muscle gains are not as quick. And intensity should be reduced during periods of rejection, but exercise should still continue. So overall, kidney transplants are very common today, and the kidneys have an extremely important role in the body. Exercise seems to play a very positive role on kidney transplant recipients and should be encouraged in all patients post-surgery. That is all I have for you today, and thank you.